The uncertainty on the faces of bereaved families at the Korle Bu Teaching Hospital mortuary is glaring. In a matter of days, all their funeral arrangements have come tumbling down following the President's directive that all public gatherings should be suspended because of the coronavirus scare.
And ever high you much fee non so ever high pa nti o mampeni onka bibi mfa ho amaye. If you say once I order mortuary no na ekano doso ekano doso yentimi nyibe yentimi ntua nti no yesre ne say oma embra from maye.
So our plan is that we'll take our loved one and bury him on Saturday morning, and then later on we'll schedule the funeral rites.
In Ghana, funerals are big social events that last at least 2 days. During this period, family members, friends and colleagues throng the occasion to pay their last respect to the dead. Unfortunately, it is this exact arrangement that the government wants to minimize. Since close contact situations like handshakes and hugs to console the bereaved are rife at such events, it is likely to promote the spread of the virus. However, some families insist on waiting out the 1-month ban in hopes of performing elaborate funeral rites for their dead.
The initial plan was to have the funeral from 27th to 29th of March. And then, as we were preparing, the ban came. So the family met yesterday and we deliberated on 2 issues: either to have a private burial or to hold on for a while to see if the ban will be lifted. The family came to a consensus that we should hold on for, let's say, a month or 2, so we could see if the ban will be lifted.
The Korle Bu Teaching Hospital morgue is one of the biggest in the country and it receives dozens of bodies each day. Per the new directive, the manager of the mortuary, DANKYI, says his outfit is encouraging families to perform private burials to prevent them from being found wanting.
A few of them have called to find out whether they can come for their bodies. Some of them will want to transfer to other mortuaries, so we allow them to do that. But for those who want to bury, we advise them that the body will release to them, but strictly on the President's directives, because there should be social distancing, and then there shouldn't be an assemblage of more than 25 people at a time for a funeral. So that's what we are doing. Some of them have opted to come for their bodies and then have a solemn, a brief ceremony from the mortuary straight to the cemetery and bury, and then they'll postpone the funeral itself.
But how feasible is the alternative of a private burial for a collectivist society like Ghana's?
Now, wow, share or my mu, obia dofo. On to me who say, Unia, papa, mamia, and see of your friend is saying, or the obesieno, obia ante.
Thankfully, the President's directive still allows for some form of gatherings for not more than 25 people. But even with this provision, some industries that often provide services like catering, seating and transportation are bound to be affected. One such group is the hearse drivers who convey corpses to families for burial.
This is what, since Monday, we've not even slept about it at all, because there are some bookings that people have made and there are this call coming in that due to this and that, they can't do the work again. And you see, it is really disturbing us. Something has to be done about this thing. Really, because we are suffering, and I don't know, from Monday up to now, every call that you receive, those that have booked you already and those that they have to do it, everything has been cancelled.
Also, the situation is likely to cause congestion at the morgue, as fewer bodies are likely to be retrieved for burial. However, the management of the hospital says it has put in place measures to prevent such an occurrence.
There are checks and balances in the system. Usually, some of them will want to transfer to funeral homes. That one is being done. Others want to take it to their hometowns, to mortuaries that are nearer to them. So usually we are always in equilibrium. We are not fully congested to the extent that we can't accept any more bodies. Bodies come in every day and bodies are taken out to other funeral homes.
So it's indeed going to be one long month for bereaved families who still want to have big funerals for their loved ones and also for others who are connected to the funeral industry, especially as they wait with bated breath for what next will be announced by the government. Reporting for Citi News, my name is Ni Ama Ama.